Have you ever found yourself wide awake at 3 a.m., staring at the ceiling, unable to fall back asleep? For many older adults, waking up in the middle of the night, especially around 3 a.m., is a common issue. But why does this happen, and what does it really mean for your health? In this video, we'll uncover the science behind those late-night wake-ups and explore what they could be signaling about your overall health and sleep patterns. Stick around to discover practical tips on how to improve your sleep and get the rest you deserve. 1. The natural aging process and sleep changes. As we age, our sleep patterns inevitably change. It's normal to find that our sleep becomes lighter, and we may wake up more frequently during the night. For older adults, waking up at 3 a.m. is often part of the aging process. This is because the body's circadian rhythm, the internal clock that regulates our sleep-wake cycles, naturally shifts as we age. Older adults tend to have shorter, lighter sleep cycles, which can lead to more frequent awakenings in the middle of the night. Furthermore, the production of melatonin, the hormone that helps regulate sleep, decreases with age. This can make it harder for older adults to stay asleep throughout the night. The body's ability to enter deep, restorative stages of sleep is also reduced, leaving many people waking up earlier than they would like. While these changes are often seen as a natural part of aging, they can still be frustrating. If you find yourself waking up at 3 a.m. on a regular basis, it's important to understand that this may simply be your body's way of adjusting to age-related changes. However, if this waking becomes more frequent or is accompanied by other symptoms, it may signal an underlying health issue that requires attention. Sleep disturbances in older adults can also be linked to other changes in the body, such as decreased muscle mass and increased joint pain, both of which can make it harder to stay comfortable during the night. As the body ages, physical discomfort becomes a more prominent factor in sleep quality, often causing older adults to wake up during the night. Increased sensitivity to environmental factors like noise, temperature, and light can also contribute to waking up during the night. As we age, we become more sensitive to disruptions, and what once might have been a minor issue, like a passing car or a sudden noise, can now be enough to wake you from sleep. Finally, it's important to acknowledge that the natural aging process and sleep changes are inevitable, but there are ways to mitigate the impact. Understanding what's happening to your body and adapting your sleep habits accordingly can help improve sleep quality and minimize frequent wake-ups. 2. Stress and anxiety leading to early wake-ups. Stress and anxiety are common causes of waking up at 3 a.m. For many older adults, the pressures of daily life, family responsibilities, or even health concerns can cause their minds to race at night, making it difficult to fall asleep or stay asleep. As the body enters the deeper stages of sleep, it is more vulnerable to external stressors, which can cause disruptions in the sleep cycle. One of the reasons older adults may experience heightened anxiety at night is due to the lack of distractions. During the day, people are busy with work, errands, or socializing, but at night, the stillness of the environment can leave them alone with their thoughts. This quiet time can lead to overthinking, causing stress levels to rise and making it difficult to fall asleep. Additionally, worrying about not being able to sleep can create a vicious cycle. As soon as someone wakes up in the middle of the night, the anxiety of not getting enough rest can worsen, leading to more wakefulness. This cycle can be particularly damaging for seniors, as poor sleep can affect mental health, memory, and overall well-being. While stress and anxiety are part of life, it's important to recognize the signs and find ways to manage them, especially before bedtime. Practicing relaxation techniques such as deep breathing, mindfulness, or gentle stretching before sleep can help calm the mind and reduce anxiety. Creating a relaxing bedtime routine that doesn't involve stimulating activities like watching TV or checking emails can also promote a more peaceful transition into sleep. A simple practice like journaling before bed can help clear the mind. Writing down thoughts and worries can be a way of letting go of the stress of the day, which may reduce anxiety and make it easier to fall asleep. If you find that anxiety or stress is consistently affecting your sleep, it might be helpful to seek professional guidance. A therapist or counselor can work with you to address underlying concerns, and in some cases, cognitive behavioral therapy for insomnia (CBTI) can help reduce the thoughts and behaviors that contribute to poor sleep. 3 medical conditions contributing to sleep disruptions. Many older adults suffer from medical conditions that can contribute to waking up at 3 a.m. Conditions such as sleep apnea, restless leg syndrome, chronic pain, and even certain medications can interfere with sleep. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, is especially common among older adults. This interruption in breathing causes the body to briefly wake up in order to resume normal breathing, often without the person realizing it. Restless leg syndrome (RLS), a neurological disorder characterized by an irresistible urge to move the legs, can also disrupt sleep. Many people with RLS experience worsening symptoms at night, which can make it difficult to stay asleep for extended periods. The discomfort caused by RLS can lead to frequent awakenings, especially in the early hours of the morning. Chronic pain from conditions like arthritis or back pain can make it challenging to find a comfortable position for sleep. Pain often intensifies at night as muscles relax and the body's stress responses increase. This discomfort can lead to waking up in the middle of the night, making it hard to stay asleep. Certain medications, particularly those used to treat heart disease, high blood pressure, or depression, can also contribute to sleep disruptions. These medications can have side effects that interfere with the body's ability to fall asleep or stay asleep. If you notice that waking up at 3 a.m. becomes a pattern after starting a new medication, it's important to speak with your healthcare provider. If you or a loved one are experiencing these issues, it's essential to consult with a healthcare provider. They may be able to adjust medications, offer pain management solutions, or recommend treatments like CPAP machines for sleep apnea or therapy for restless leg syndrome. Other medical conditions, such as depression or anxiety disorders, can also affect sleep. These conditions often lead to disturbed sleep cycles, causing individuals to wake up early in the morning and have difficulty falling back asleep. If sleep disruptions are linked to a medical condition, managing the condition properly can significantly improve sleep quality. 4. The role of diet and lifestyle in sleep quality. The food you eat and your daily habits can significantly impact your sleep. Waking up at 3 a.m. can sometimes be linked to eating too close to bedtime. Consuming heavy or rich meals, especially those high in fat or spicy foods, can cause indigestion or acid reflux, both of which can disrupt sleep. The discomfort caused by these conditions may cause older adults to wake up during the night, especially in the early morning hours. In addition, caffeine and alcohol consumption can play a major role in sleep disruptions. While alcohol may initially make you feel sleepy, it actually disrupts the sleep cycle, leading to more frequent wake-ups during the night. Caffeine, on the other hand, is a stimulant that can interfere with the body's ability to fall asleep and stay asleep. Even small amounts of caffeine consumed later in the day can impact sleep quality. A lack of physical activity during the day can also contribute to waking up at 3 a.m. Regular physical exercise promotes deeper, more restful sleep by regulating the body's internal clock and increasing the amount of deep sleep. Older adults who are sedentary may find it harder to fall asleep at night and may wake up more frequently during the early morning hours. To improve sleep quality, consider adjusting your diet and lifestyle. Aim to avoid heavy meals, caffeine, and alcohol in the evening. Incorporating more physical activity into your daily routine can help regulate sleep patterns, making it easier to fall asleep and stay asleep throughout the night. Excessive screen time before bed can also be a disruptor. The blue light emitted by phones, tablets, and computers suppresses melatonin production, which interferes with your ability to fall asleep. Limiting screen time an hour before bedtime can help ease the transition to sleep and reduce the likelihood of waking up during the night. Lastly, creating a sleep-friendly environment in your bedroom, cool, dark, and quiet, can help improve your chances of staying asleep. Consider blackout curtains, white noise machines, or using a fan to keep the room comfortable for sleep. 5 hormonal changes affecting sleep. As we age, hormonal changes can also affect sleep quality. For women, menopause brings about significant hormonal shifts that can cause night sweats, hot flashes, and disturbed sleep. These changes often occur in the early hours of the morning, around 3 a.m., which is why many older women experience waking up at this time. The drop in estrogen and progesterone during menopause can disrupt the body's ability to regulate sleep temperature, causing discomfort and waking up during the night. For men, low testosterone levels associated with aging can also lead to changes in sleep patterns. Testosterone plays a key role in the regulation of sleep, and as levels decrease with age, men may experience lighter sleep, more frequent awakenings, and a decrease in deep sleep. This can lead to waking up at 3 a.m., especially if testosterone levels have dropped significantly. These hormonal fluctuations affect the body's natural circadian rhythm and sleep-wake cycle. They can cause disruptions in sleep, leading to more frequent awakenings during the night. If hormonal imbalances are suspected, it's important to consult with a healthcare provider who may recommend treatments or therapies to help regulate sleep. In addition to menopause and low testosterone, the aging process itself can cause a decline in the body's production of melatonin, the sleep hormone. As melatonin levels decrease, it becomes harder for the body to enter deep, restorative sleep. This is why older adults often find themselves waking up at odd hours, like 3 a.m., and having difficulty returning to sleep. Managing hormonal changes through lifestyle adjustments, therapies, and medications can help improve sleep quality. A healthcare provider can help determine if hormone replacement therapy or other treatments are necessary to address these imbalances. Conclusion: waking up at 3 a.m. is a common issue faced by many older adults, but it's important to understand the underlying causes and what they really mean for your health. Whether it's the natural aging process, stress and anxiety, medical conditions, diet and lifestyle, or hormonal changes, each factor plays a role in disrupting sleep patterns. However, identifying the root cause of these early morning awakenings is the first step toward improving sleep quality and overall health. For older adults, sleep is more than just a time to rest. It's a vital part of maintaining physical, mental, and emotional health. Disrupted sleep can lead to a wide range of issues, from memory problems to a weakened immune system, increased risk of chronic diseases, and mood disturbances. Therefore, it's essential to address the factors contributing to sleep disturbances and work toward healthier sleep habits. One of the most important things you can do is to establish a consistent sleep routine. Going to bed and waking up at the same time each day helps regulate your body's circadian rhythm, making it easier to fall asleep and stay asleep. This consistency signals to your body when it's time to rest and prepares it for a deeper, more restorative sleep. In addition to a regular sleep schedule, Practicing relaxation techniques before bed can help calm the mind and body. Consider incorporating activities such as meditation, deep breathing exercises, or reading a book to unwind. Creating a calming bedtime routine can ease the transition into sleep, reducing stress and anxiety that might otherwise keep you awake. Another key factor in improving sleep is ensuring your sleep environment is comfortable and conducive to rest. This means having a mattress and pillow that provide adequate support, keeping the room cool and dark, and minimizing noise and distractions. A comfortable sleep environment is crucial for achieving deep, uninterrupted sleep. If you continue to wake up at 3 a.m. despite making adjustments to your lifestyle, diet, and sleep environment, it may be time to seek professional help. A healthcare provider can help identify any underlying health issues, such as sleep apnea or restless leg syndrome, that may be contributing to the problem. They may recommend a sleep study or prescribe treatments that can improve sleep quality. It's also important to be mindful of your diet and exercise routine. Avoid heavy meals, caffeine, and alcohol before bed, and try to engage in regular physical activity during the day. Staying active promotes better sleep and reduces the likelihood of waking up during the night. Ultimately, improving sleep after 70 requires a combination of understanding the natural changes that occur with age and making the necessary adjustments to your lifestyle. With the right approach, it's possible to enjoy better sleep, better health, and a more energetic, vibrant life. By recognizing the reasons behind waking up at 3 a.m. and taking steps to address them, older adults can take control of their sleep and overall health. Restful sleep is essential for maintaining quality of life, so don't hesitate to make the changes necessary to improve your rest and well-being. Managing stress with a holistic approach. In addition to individual relaxation techniques, managing stress in a more holistic way can make a significant difference in sleep patterns. Yoga, Tai Chi, and other mindfulness practices have been proven to reduce stress and anxiety while improving sleep quality. These activities not only help relax the body and mind but also promote flexibility and mobility, which are beneficial for older adults who may suffer from joint pain or limited range of motion. Engaging in outdoor activities, such as walking in nature or gardening, can also be incredibly beneficial. Exposure to natural light during the day helps regulate your circadian rhythm, and physical activity during daylight hours increases the chances of restful sleep at night. Getting fresh air and experiencing the sights and sounds of nature can also serve as a powerful antidote to the stress of daily life. Incorporating calming practices into your daily routine, such as taking a warm bath before bed or enjoying a cup of caffeine-free herbal tea, can help signal to the body that it's time to unwind. These habits contribute to a peaceful transition from the busy thoughts of the day to the relaxation needed for deep sleep. Seeking medical advice for underlying conditions. If you've adjusted your routine and lifestyle, but still find yourself waking up at 3 a.m., it's crucial to seek professional medical advice. Many sleep disturbances in older adults can be attributed to medical conditions like obstructive sleep apnea, depression, or chronic illnesses such as diabetes and heart disease. Conditions like sleep apnea are often undiagnosed, as they occur while the person is asleep, leading to disrupted breathing and frequent wake-ups without awareness. A healthcare provider may recommend a sleep study, which can help diagnose sleep disorders and guide treatment options. For instance, sleep apnea can be managed